Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Incident Command Day 45, giving you the update from Albany Med on the coronavirus. In our 5 surrounding counties, we have 1,688 patients who have tested positive for COVID-19. That's about a 4% increase from yesterday. Testing continues as an outpatient in multiple different locations. Inside here in the medical center, we have less patients in the hospital with COVID-19 than we did the day before. We have 57. Yesterday we had 60. That breakdown is we have 34 on the floor, we have 23 in the ICU, and we currently have 17 on ventilators. Fred, we continue to see nice progress there.
We absolutely do. So we've actually gone down a little bit in terms of the number of units that we're using. We're still in tier 2 for our critical care beds, but we're going to be turning off some of the units over the next 24 hours, and we'll probably collapse to tier 1 soon.
That's great. Yesterday we talked about the outpatient pharmacy, the ability to pick up medications at a location outside the medical center, which is meant to reduce the traffic inside the hospital here. We talked about that as a service that was going to be Tuesday, Wednesday, Thursday of this week, and I had mentioned that that was for our employees. Somebody on Facebook asked the question, why not make that service available to people who use your outpatient pharmacy that are not employees? And the answer is yes, you can. They also just need to call 262 Meds, schedule the time, and they can pick that up. So we thank that person for asking that question and giving us a chance to clarify that.
Tremendous service, really a tremendous service.
PPE burn rate. We talk about this. We spoke last week about the executive order from Governor Cuomo that required all employers to provide to their employees who are facing the public face coverings, which we define in the medical center as masks. And we were saying that we might expect that we could have as many as 150,000 surgical masks per week used in order to meet that executive order. We wanted to talk about that, and I think, Fred, you have some update.
So yes, Dennis, we are using literally thousands of masks a day, and we probably are going to get close to that upper number that we talked about last week, that 150,000 over the course of the week. Nonetheless, our supply guys have done such a good job sourcing. We still have very adequate supplies. That doesn't mean we shouldn't try to conserve. Use the masks in an extended fashion where possible. Try to not use multiple masks in a given day if at all possible.
So we still are going through a lot of masks. We believe we have enough on hand. We're going to monitor that very carefully going forward.
Yes, and those are the surgical masks, the N95 masks, because of the reprocessing that we're doing. Again, we have lots of N95 masks.
Our current process is when you come into work, you get your temperature checked at one of 3 locations on the main campus, and that's often when you are issued a mask to start your day. We're now starting a new way of checking temperatures at 2 or 3 of our different locations, and it's a way in which they'll use infrared to measure the temperature.
Yes, actually, I think this is something you've perhaps seen on TV, people walking through airports in Singapore and Hong Kong where they stop momentarily, literally for a second, and the system can measure their temperature. So we'll be instituting that in the next couple of days at the 3 sites of entry into the medical center.
And there's a lot of advantages to this. Number one, there's going to be less consumables of things that are used to take temperatures when you have to take like an oral temperature or an ear temperature. It's going to be very quick, and obviously we won't have to touch the employee when they come in, which helps from a virus transmission standpoint.
And it's very accurate, Dennis. Yeah. It's very accurate.
So thank you to our folks in the engineering department, our bioengineering department, for helping get that set up. Fred and I are not the only ones who do videos here. We actually had a video done yesterday by Dr. Carrie Danziger and Rebecca O'Donnell, and it was about PPE, and it was some of the most frequently asked questions related to PPE use. That's also available on social media. We encourage people to take a look at that.
It's a great video. Answers a lot of questions, very important questions about the appropriate use of PPE.
We also had a video done with 5 of our physician leaders, and that is also available. We encourage you to look at that, and this is really their opportunity to say to the public, we're still here for you. And as we move forward and as we're allowed to start scheduling non-emergent cases, we're prepared to take that on. We know the governor yesterday spoke about a directive that is going to begin to turn on non-emergent cases in various parts of the state. Fred and I said we wanted to come back today and talk about that. So I'll let you begin.
So we still don't have a lot of information about the governor's directive. We're expecting the Department of Health to provide some guidance, perhaps later today or later this week, on exactly what the rule set's going to be about doing elective surgery. I would say that this is really an important topic. There are literally thousands of patients in our system waiting for procedures, waiting for screening or diagnostic or therapeutic procedures. Screening procedures, just surveillance, looking for things like cancer and other kinds of illnesses that people could have undetected. Diagnostic procedures where we know something's going on and we're trying to sort out exactly what it is, or therapeutic procedures where we know what's going on but we need to intervene and correct something for a patient. So we anxiously are awaiting those guidelines. We've got a group working very hard developing how we would go forward with the directive once it applies to us here at the medical center.
And we know exactly what's happening here on this campus, and we believe that we could safely continue to care for COVID-19 patients. We could care safely for emergency cases that come in, and we could safely care for people who need to have things done on an elective basis.
As you know, Dennis, today we started with about 490 patients in the hospital. We have a licensed capacity of 766. So from a bed perspective, from room in the medical center, that's simply not a problem. We're using our ORs at probably half capacity, so that's not a problem. And you heard about the PPE already.
Right. So we consider this to be an advocacy issue as much as anything for the people of the Capital Region, that we want to be able to take care of their medical needs as well. Fred, what is today? What is today?
Today, actually, there are a couple things today, but we're wearing T-shirts about our admins. Today is Admin Professional Day. This is a day that we acknowledge the support, guidance, that we get from our admins. As Dennis said, our left brain or right brain, I forget which, but they do a lot for us. So shout out to them. They're really terrific. These T-shirts were made specially for us. So for those of you who track our wardrobe, these were specially designed just for Dennis and I by Lori Hansen and
Sam Stelmashik helped make these. Yeah.
And it was actually Maria Brett, my admin's suggestion that perhaps we should wear T-shirts today on their day. And so we did that.
So I know Maria, she's fabulous. Robin DeMuro in my office is also my peripheral brain. So to all admin professionals at the medical center, we thank you. You're as much a part of what we do here every day as anybody, and honestly, we can't thank you enough.
But today's another day.
Today's another special day. So last week we talked about how the Center for Disability Services and the New York State Industry for the Disabled got together and made face shields for us. Well, the Center for Disability Services also has a facility called St. Margaret's. It's a residential facility, and inside that facility is a very special person called Lily. And Lily is 15 years old today, and so today is her birthday, and we wanted to wish Lily a very special happy birthday as well.
Happy birthday, Lily.
Because we know that she might be watching this. And it's Earth Day, so we celebrate the Earth. So today's a special day.
Trifecta.
All right, so today's a special day. Every day is a special day at the medical center because of our workforce. We thank all of them for what they're doing. We'll be back again tomorrow with some more updates. Once again, we thank all of you. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.